Christina Moreau. I am the Director of Institutional Research and Analytics here at UVA, and want to welcome all of you here for a conversation that we want to have today around institutional data governance, and in particular, when we think about the use of student data in support of research, the ethical considerations that raises. I am lucky to be joined by a group of institutional colleagues who are going to help us on this discussion. We've thought through some questions to get us started, but certainly our intention is to ensure that we give you time and space to ask questions and contribute to this discussion, especially as the School of Data Science embarks on its research strategy and how this information can contribute to their objectives. So to start, I'd like to introduce first, all the way to my other right, Laura Hawthorne. Laura is an Associate Vice Provost and University Registrar here at UVA. She also is a lecturer in religious studies and has extensive experience with academic policy development and application. Next to Laura is Chris Holstitch, who has maybe more titles than anybody I know. Chris is a professor of emergency medicine and pediatrics. He is also the executive director of student health here at UVA. He's the chief of the Division of Toxicology and the director of the Blue Ridge Poison Center. And especially in his capacity in student health and in toxicology, has worked with large data sets of our student population. And last but certainly not least is Sarah Radcliffe. Sarah is a professor and the director of biostatistics and of the Division of Biostatistics. She's the associate chair for research for public health science and is also the director of the iThrive Research Methods Core. I think I got that right. And in her capacity, Laura also lectures the students in the Masters of Public Health. Sarah, Laura, one way to change the other. Now you're not. She does lecture graduate students in the Master of Public Health Administration program, in particular around the ethical issues of data management and statistical analysis. So we have different representation here of experience and breadth, both within the university and Sarah joins us from the University of Pennsylvania, where she spent 17 years. So to get us started, I've asked our panelists to each talk to you for about 5 minutes and address 2 issues. First is, what does data governance mean to them? That's a construct that is used often, but has maybe different interpretations or meanings for people. So as they share their experience and perspective with you, I want you to be clear about the lens through which they look at this issue. And then second, I thought it'd be helpful for them to provide an example of how, with effective institutional data governance, they've embarked or seen an example of research involving student data that contributes to the student experience. So with that, I'd like to ask Sarah to get us started.
Sure. So what's data governance to me? I like to think of it as the 5 W's. Who, what, when, where, and why. So who can play with what data? When can they play with it? Which elements can they play with, and why do they want to play with it? So there's a lot of times in data governance where I might have access to some data for one purpose, but just because I have that data does not mean I can do this other why with the same data set. So it's thinking about those 5 elements within any project is data governance. Coming from a health perspective, doing a lot of health research, a lot of this also gets controlled by the type of data that we're playing with. So we would think of it as the identified, limited risk, or fully identifiable data, and some of this being health comes under sort of the HIPAA constraints, you've probably all heard of. But the big ones with governance really depends on what type of data you may have access to. So de-identified data where you can't determine anyone who's in the data set potentially may have less governance structure on it. So we're not as concerned with some elements of those W's as we would with a fully identifiable data set. some projects, a fun one actually looking at basically these things. Digital media use and sleep and the effect on teenagers, college students, and just how badly sleep can happen with it all. And that whole issue of governance means I don't get to tell you who the person was that likes to drink more caffeine than anyone would think is humanly possible, and the number of car accidents they may or may not have had because of lack of sleep, because of all the caffeine intake and nighttime interrupted sleep with texting and media use that I get to tell you in general is bad. So that's kind of how I come from the approach of data governance.
Thanks, Sarah. Chris, what about you? How do you define it?
So the student population, there's an organization called the American College Health Association, which is going to be doing a giant data warehouse of all the universities actually in this country. And we are part of the committee that oversees as that's being developed and is being communicated with the various universities, and we struggled with this question. And we came out with, I want to just abstract a few things from that, which again was gone through with many of our peers, and looking at a population that's vulnerable and as stewards of the information as that gets uploaded from the universities, and we're looking at quite a bit of data that will be coming up to that national organization. But one was to articulate clearly the requirements for safe and effective input, access, retrieval, exchange, reporting, management, and storage of data. Second was to inform rules to control the usage, security, quality, integrity of data during the life cycle of that data. Third is to recommend compliance with applicable laws, regulations, exchanges, and standards. And the fourth is to conduct operations with ethics, integrity, openness, and transparency, supporting the shared interests, and for us, of the university and our collaborators. So there's a lot of opportunity, I think, tremendous data bases, tremendous data sets, and as we look at that national organization, as we look at other data sets, how do we utilize those data sets, certainly for those of you who are researchers in in this area of expertise, but also certainly what's being put into these data sets and how do we interpret and engage those who are putting data in, which we'll talk about more, I think, later.
Great, thanks. Laura, what about you?
So I think there are at least three lenses that I bring to my work when I think about data governance. The first is obviously my registrar hat. As registrar for the university, I'm also the FERPA officer for the university. So FERPA is the federal act that protects the privacy of student educational records and also ensures their rights around those records. And so that's obviously a lens that I bring to questions of data governance. The second lens that I bring is that Christina mentioned my background in policy work. So for about 10, 15 years before I moved into this role, which I did about almost 2 years ago, I did a lot of work around policy related to faculty policy and academic policy. And so wearing that, with that lens, I worry about protecting our students from exploitation and manipulation. So dealing with questions of faculty wanting to use certain software products in their classroom created by third-party vendors, and third-party vendors having license agreements that essentially give them the right to do whatever they want with the data that they collect on our students while they are using that tool in the classroom. So that's problematic. So that's a lens that I still bring into my registrar work, right, is the protection of students from exploitation and manipulation. And the third lens that I bring really comes from my training as an ethicist. And so at an even deeper level than the legal compliance, I'm really interested in creating an environment that makes it easier for us to do the right thing when it comes to how we use student data. I'm very concerned about making sure that we're not making it easy for people, or even perhaps possible for people, to use data in ways that might harm or hinder the success of our students, especially students who might already be vulnerable for various reasons. So if I'm an instructor teaching a statistics class and I'm looking at 5 years worth of data for my students, and I notice that men are consistently underperforming women in my class as far as GPA goes, the appropriate response is not to encourage men to not take my class, right, or to take easier statistics classes. So I'm really interested in sort of the ethical framework and guidelines that we put around our use of data, and I would feel a lot more comfortable releasing data to be used for various purposes if I was confident that we had spent time as a community clearly articulating what our values are when it comes to the use of student data, and then translating those values into practices and guidelines that are shaped by them. So that's one of the areas where I'm very hopeful the School of Data Science is going to help us make some progress. We've got lots of folks that are already thinking about these things, but I'm hopeful there will be teams of interdisciplinary scholars who are thinking about these issues and helping us become the leader in this area. As far as examples, one I can mention is that, and again, there are people in this room who have more examples of this than I do, having been in my role only 2 years, but an example of sort of a successful use of student data, or that promises to be successful, is that, we have a small group of professionals in student affairs who are working with institutional research and analytics, particularly with its University Business Intelligence team, to create a data set that allows those professionals to start to ask some very probing, thoughtful questions about what are the different factors that contribute to student success. And that's the kind of work that I'm really interested in making more possible by using data appropriately.
So thank you. And so let me pivot and pick up a little bit on your themes about some of the concerns. And the ultimate goal here is to have a governance model that does facilitate these opportunities that contribute to mission. But what, in your opinion, kind of rises to all of you as kind of the primary risks around ethical use of student data? Like, what is it that, in your experience, especially here institutionally, do you think is especially tricky or challenging as we look to manage the responsible use of student data? And Chris, maybe I'll ask you to get started.
Yeah, so think about the health data, for example. I think it's challenging. And as we look at that data, and we've looked quite a bit at it, both at the national level and here institutionally, the health data, if you're looking at ICD-10 codes now, are exceedingly challenging because it's only as good as the providers who are putting those codes in.
And those codes are?
And ICD-10 codes, so when you're looking at codes, these are the diagnostic codes, right, that the clinicians are using. And we took a look at this nationally. We had a thing called the College Health Surveillance Network that's here, where 32 universities were putting data codes, ICD-10 codes were coming to our university and taking a look at it. And what we found, there's a couple things. One is we did a study just taking a look at those codes. And you can imagine if you're looking at sexually transmitted diseases, right? Pretty hot button topic in this population. Depending on how those codes are placed in, how you're interpreting the data that's being uploaded, what clinics are the students going to, you could really have tremendous, and we show this, variation, so that you could look at one university and say, boy, the University of Virginia, those students are really clean students, there's no problems, but Virginia Tech, the STI codes, I'm just making this up. And we actually took the 32 schools and looked at their data, and the tremendous variability. It wasn't to show that, boy, there's a tremendous variability of STIs, but it showed, we were trying to show that, one, where are the students going for STIs, sexually transmitted infections, and how are the clinicians putting and uploading the codes? To give you another example, influenza. We did get 15 of the schools to all agree on the diagnostic codes that would be used. What was influenza-like illness? That data, then we could take a look around the country at both large and small institutions to be able to follow the trends of influenza in the student populations, then potentially working with the CDC as another data source. That has a lot of value. And so what we're learning, and this is not new to those of you who are doing research, we really need to work with the clinicians on how we're putting the codes in, and then we have a consistency on the definitions of these different disease processes. If we're going to use these, otherwise it's going to be worthless. The data that's coming out we just can't use. The other that I think that's challenging is how far, Laura alluded to this, you can drill down on our student population based on demographics. If you really want to study, for example, transgender students, that's challenging. It's a very small population. And then you start breaking it down into the school, ethnicity. You can start to identify who these individuals are. And that's why I look at school data sciences to what is safe, what are we looking at, what can we do safely with this data? Because again, this is a vulnerable population. We want to make sure our students stay safe, and yet exceedingly important from my perspective, these data so that we can, one, from a research, and two, but also resource allocation. There's a limited amount of resources for our students in regards to health. How do we do our prevention efforts? How do we allocate those resources? What groups are we targeting? And if we do target them with interventions such as alcohol, or doing things such as motivational interviewing, which groups are we targeting, and are we making an impact? Are we seeing a change and a consistent change as the data is being entered? So we can go on for quite a while, but it's just one perspective.
Yeah, I mean, in part, when I hear you say that, is that there's a consequence to, I mean, we all talk about the importance of good data for analytical purposes, but you're literally saying there's an potential, there's an ethical issue to really have data or incorrect data on the wellness and health, especially through the lens that you look at it, of our students.
Correct, and I think we have a unique opportunity for the student data that's coming from student health specifically. The health system is different. The health system is doing billing, and there's a way that these codes are placed in from a billing standpoint. In the student health across the country, the majority are not doing billing. They're actually putting the codes in as they would, based on what's the true reason that they came in. And I think you can really get an opportunity for consistency. I think there's a huge opportunity for us to lead. Quite frankly, the University of Virginia, I think, has an opportunity to lead in data sciences in this area. But in getting the clinicians all on the same page, and they're eager to do that.
Great. So what else, Sarah, when you hear that perspective?
I agree with a lot of that. I've lived the experience of multiple data sets that people think they're entering the same piece of data in the same variable name, and then you look at the data and discover that you're not. And so one of the big challenges, I think, is that data quality, and then people looking at the data and understanding what is it they have, so you're not making conclusions that are incorrect for the data that's available. But then I'll also take a slightly different track and go, as a researcher, we actually also can have issues with identification within research staff. So an example from one is when someone actually came and were upset that a student had gotten a letter to ask them to participate in a particular study based on a particular disease that they had been diagnosed with, and the person who had mailed out this letter was someone they knew who was a research assistant on the study, and there is no way on the planet they wanted this person to have known this diagnosis. But they had just been identified because they're on the study as research staff. And so I think we also have issues around thinking about not just the data we're collecting, but also who's viewing the data and why, and that there may actually be ethical issues where it's perfectly fine for this person to see this identifiable piece of information. They need it to conduct the research, but on the flip side, the students who are being the research subjects may not have wanted that person to have known. So we have these other ethical issues that we may actually need to think about when we think about governance.
Or is that kind of from your...
Yeah, I mean, I think a third piece that I might add, and it builds especially on what Chris was talking about, is this idea. One of the things that's really impressed me since being in the role, and we spent a lot of time talking about how we define the various elements related to student data, and how challenging it's been for us to make significant progress with that work just in the last 2 years. And also the kind of multidisciplinary, the kind of complicated team of people that you need to bring together to really do this well, right? You need people who actually know how to analyze data responsibly and well, right? So they've got those data skills, and then you need people who are sort of the subject matter experts in the data itself, right? So figuring out which questions to ask is really important because we have limited resources and we can only answer so many. And so how are we going to decide which questions are the most pressing for the institution, most directly related to student and faculty success?
So kind of, as I hear you describe what's especially tricky in these issues, I want to maybe delve a little further into this issue of kind of openness of data. When I think about the ethos of the School of Data Science, and in particular how it's looking to achieve its mission, it's established various centers to support its work, one of which happens to be a Center for Data Ethics and Justice. And in that, there's an initiative that they've launched on openness, literally it's called the Openness Initiative. And that initiative seeks to kind of study this interplay between the ethics of data and how is it that you either by design make it available or not. We have so much demand for data sets, for information to be used to support activity, but yet this tension around how do you consider that. So what are your thoughts around what's required to be able to make decisions around how to make data accessible or open? And by the way, I also want to make sure that you have thoughts on this particular topic as I look at several of you that do chime in. And how we kind of need to, what is the consideration we need to give in that regard, and who's involved in having that discourse?
So I can start on that.
Great, thanks.
I think that we need a collaborative process for reviewing data requests. I think it needs to be more than just one person. For example, me saying yes or no. Over the last 18 months, 2 years that I've been enrolled, we've had a lot of conversations about institutional data governance, and the IRB model comes up, right? And I think that that's a model that's promising that we should look at. We tend to, I've noticed that we've paid a lot of attention because we've had to, right, to the ethics of human subjects research and what's okay to do in that kind of environment. And I don't think we've brought the same attention to the research or analysis that we do for internal purposes. And I think we've underestimated perhaps, and as technology is changing, maybe these risks are actually becoming greater than they were in the past. I think the way that we use data to improve our processes also carries with it a certain degree of risk, and we haven't brought the sort of same scrutiny and support to that process that we have to human subjects research. So I think that's one of the challenges or potential solutions. The other thing I spent a lot of time, I'm not a data scientist, but one of the things I spend a lot of time worrying about is whether when we do de-identify data to make sets of data available when it comes to students, how do we ensure that it's really de-identified, right? Because if we think we've stripped everything out of the data set that can identify a student, then you have a few students or a few people who are familiar with the context of that data who can suddenly start connecting some dots, and suddenly they've identified people, and then that allows them to connect other dots, and so I spend a lot of time worrying about that. So
I was going to say you should. As someone who has to de-identify data, I spend a lot of time that's probably one of my biggest nightmares. That everyone thinks, though, I can say everyone, but a lot of people think that de-identifying data is a really easy procedure. Even at times what you may read with in the health realm, like safe harbor, you just delete these 18 elements and you're good, you have a de-identified data set. I would say de-identifying data is one of the trickiest things out there. It is so easy to have one or two people that can be easily identified from the characteristics that remain. And then, honestly, part of our job is, with de-identifying data, is to make it so that it's hard to identify who's in that data set, and yet that job is actually made even harder by social media these days. So many students will post, oh, I just signed up for this research study. Great, now everyone knows you're a subject in this data set, and I have to make sure there's nothing unique about you that would make you identifiable in this data set. Because they're not posting that to one person, they're posting that to 5,000 people, and it just makes it so much harder. So
Information Act on what is accessible for the public if they ask for it. If we put it together, do we have to give that to them, right? So if I'm putting together certain sets of data and the Washington Post asks for that, do they get that data because we put it together? Whereas if we did put it together, we don't have it, my team doesn't necessarily have to. I think we're going to have to really talk with our experts with FOIA on what this means too. Because I will tell you, we have some challenges in the newspapers, the media can really misrepresent the data also. If you start looking at the universities, and I have tremendous concerns right now with the mental health data that I'm constantly getting asked about with our student population, resource allocations, what demographics of our students, you can really misrepresent that. And so it's not just research, there's many other entities that want this data, and how are we going to deal with that aspect as we put it together?
So let me kind of also just ask, if you could govern, part of what I'm hearing you say, Laura and Chris, in those comments too, is that you need to understand what you're doing, how the data are applied, right? So this whole concern about the interpretation of the data, how do we control for that? And in your domains, what are some of your ideas of how you could look to contribute to ensure, right? And likewise, as the School of Data Science is working and partnering with schools and units, so much of this hinges on that knowledge of what the data mean, assuming the data are good to start, hoping. So what are your thoughts on that? Or anybody's. This is a challenge, right? You can't control, we especially in institutional research, look to make data properly de-identified data accessible to support research, but so much of it hinges on
I can tell you some characteristics that make me feel a lot better about sharing data are that I know it's being shared for a specific purpose. I know that access to it is going to be controlled. So for example, we met not too long ago with a faculty member who was interested in getting a pretty robust data set, but it was going to be accessible only to students who were in a particular data facility. While they were there, they would not be putting it on their laptops, they would not be accessing it through the web. And she was a professional who would be teaching them how to use that data responsibly, how to interpret that data responsibly, and then that data set would go away when that class was over. So that, I know that we can't control the data that much all the time, but those are the, so having the expertise, having the controlled environment, and making it accessible within that, those are the kinds of things that make me feel a lot easier about sharing the data.
Chris, you had shared about the model that you use in student health to try to kind of also make sure that there's, a consideration of a little bit to Sarah's why and who when you're looking to embark on a study and who's involved and their ability to actually understand how they're using the data.
Yeah, so we have the researchers that might have a question. We have an epidemiologist that's at Student Health who's fully dedicated to our data sets. We have the clinicians who are putting the data in so that they can help to interpret, what does it mean for the diagnostic codes and how are we doing those codes? And it's really getting all the parties together that have really touched that data. I think then as the researchers, and this is again for the School of Data Sciences to consider, once the research is done, does that get vetted again to make sure that indeed what is coming out of the conclusions is truly accurately being portrayed from what is the data that's there. And again, going back to the diagnostic codes, I think are exceedingly challenging from that perspective, unless we have a really good, robust, consistent way that our clinicians are putting in. We have that opportunity. I think it's really an exciting time for us. I think we can do that. And there's quality assurance measures that I think are really important in healthcare. And as we look at mental health, there has to be some consistency. We're working on that internally right now with the clinicians.
And so in this example, Laura, that you gave of the faculty member working very closely to kind of control interpretation, that's a unique one. If we think more of the norm that is our experience, what's the voice of the student in this equation? I mean, if we talk about kind of data governance and appropriate use and looking at this and caring for our students, what part do they play in this directly? I know that obviously in a lot of what we do, whether it's in survey research, for example, you have the informed consent. In theory, they're reading how their data are going to be used. How much they actually engage in that, who knows? But I'm kind of thinking looking again, we're generating data sets both based that they're aware of, that they're helping to contribute because they're giving the data. We're developing additional data sets from other information we collect. Where's their voice in this? Do you think they should have one?
I do, but I think one appropriate, there may be multiple appropriate opportunities for them to have a voice, and I think increased transparency is really important. So that they, so that we're educating them, not just informing them, but like really educating them sort of about what their expectations should be about how their data should be used in the world. It's bigger than just while you're UVA, but sort of taking that large view. But I think that a really appropriate way to engage students would be if, as an institution, we did want to embark on that exercise that I mentioned at the beginning, which is clearly articulating what our values are around responsible use of student data, drawing some boundaries for ourselves, like we think it's okay to go up to this point and no further, that this is a line we're going to draw and we're not going to use student data for that purpose ever, right? And I don't know if that line exists, but I would really like to have a conversation about what our values are when it comes to data. How's that going to govern our practices? And I think students absolutely should be part of that conversation and helping to develop that, whether it's a policy on the responsible use of student data, or a vision statement or a value statement. I think they can be involved in that.
And I was going to say, I think too, it goes to if we do something like an IRB type model,
Yes.
having student representation on that, so you're actually getting for each project that's requesting data, student kind of buy-in that yes, this is something that's thought about the student's point of view and what the consequences might be for students from this use of the data.
I think it's a great idea.
Well, and I'm going to kind of turn to, yeah, go ahead.
So one thought I've had, and we know that there are certain sets of data, and I'm thinking more operations within the university, but first generation, we know that is a focus now. So we respond to lots of individual requests for data. Could we be better served by setting up a data set and spending more of our time? We could control access, but sitting down with the people that we have access to say, this is what's here, this is how you should use it, and now go use it. But everybody's using the same set of data. We take the time we were taking to keep delivering individual sets of data to actually having these conversations that we sort of talked about.
Right. And if there were a way to do that with more ability to sort of check up on how it's being used. Like, for example, maybe it's not such a good idea that you can dump all of that data into a different format and do whatever you want with it, right? And so maybe better tools that allow us to ensure that it's being used appropriately and not sort of once you're in the door, you have access to everything, you can do whatever you want with it, including put it somewhere and give it to somebody else. It's just a trust and verify. And right now, I feel like we don't have much ability to verify.
I think giving all
Trust and
people
audit.
data anyway, just
Right.
giving it to them all one-off with absolutely no control or conversations about it,
Right.
versus building a set of data and saying, okay, here it is, here's how you can use it. Let's get together periodically and talk about how we're doing it.
So some of the discussions that came up with the American College Health Association and data. So the data that they're going to, it's a broad amount of data that they're going to be collecting amongst all the universities in the country. That comes from survey data of the student population. It's called NATA. It's a survey that comes out annually. It's data on space utilization. It's about the financial. It's also looking at the potential for uploading of ICD-10 codes in the future and how that might look. There's a huge ability then with that such a huge data set, right, for researchers then to do some good quality research. It's going to be interesting with, again, the school data sciences, with a monster data set like that, how can we help them nationally, right, organization, because they're struggling with some of the same questions that we're talking about today. And I think they have huge capabilities. And with a population, there's 20 million undergrads alone, undergraduate students, with data that can be potentially uploaded from small colleges to major universities regionally. And you can do, and we looked at how you can do some of this so that it's you're bringing the data in different geographical locations. So you cannot identify schools, but at least you can watch and do surveillance. This is where the CDC has interest in this too. So I do think there are some tremendous potentials here, including with working with school data science and working with national organizations who really need help in this arena too. It's not a big operation, but they have some really big hopes in this. And then look at small groups nationwide, like the transgender groups, and how are they doing matriculation and such? What experiences are they having? So
I was just gonna say that one, I think a really important point we really haven't articulated yet is that how the data came to be is really important to me. So if a student participates in a survey and is informed up front that that data is going to be used for various purposes, that's one thing. If we have data on a student because they have come here to get their education at the University of Virginia, I think it's a very different question of even if they're first gen, right? I mean, we've had conversations about this. If they're the first generation in their family, do they understand that we're going to be scrutinizing them because they're first gen and perhaps sharing their data in ways that we wouldn't if they weren't? All in the name of ensuring their success or tracking their success or trying to optimize their success. But still, it just seems to me that that's a very different kind of data set with greater sensitivity than when they participate in Zero or another survey that they've opted in.
I was just going to add, coming from another institution, we actually had done something similar whereby data science, this is a great opportunity, actually did the infrastructure for a cloud-based solution for certain student elements. So there was a limited de-identified data set available. You got permission to access it on that cloud server. There was no ability to download the data at all, but it gave you basics to be able to play with, to look, is there a potential to answer this question in this data set? And then you went and applied for access to a bigger data set that might have more controls needed, and now you know who has it and why and what they're doing with it. But a lot of those smaller requests never came up because you could go in and go, oh, there's only 10 people here that would satisfy this. They're never going to give me the data on 10 people and it's not going to answer the question, so we can't. So that infrastructure and support would be a great opportunity for data science to sort of be able to take the lead within that realm to supply it, and what should be the limited elements that people with sufficient training can have access to.
Or even a tool that doesn't give you access to the row level data, right? So that you can ask certain questions and get the answer, but you can't do sort of everything about every student. That would also greatly increase my comfort level.
Yes, we actually have that on the human subjects, the health side. We have a tool where you can go in and actually get aggregate level data, but if you want individuals, you need to apply for that from there.
Yeah,
So something
that's great.
similar for students would actually be a
that's
great
really exciting.
resource to
So
have.
more data science can help us do these things. I would be
Which is
greatly
a
indebted.
segue.
Yes, sir.
Which is why we keep looking. I keep on looking at time.
I'm not related to it, stop.
Yeah. Well, speaking of that, I, up until last week, was a data scientist here at the hospital, and I was one of about 4 people, I think, that got to work with the employee data. So, like, you have to have all sorts of, safety around patient data, and then, like, the employee level is even, like, more secure, that level deep inside of that. And, well, like we were saying before, there is some Virginia Department of Health, like, aggregate, I can't remember what it's called anymore, because I've only used it a few times. Oh,
Essence?
no, not that one.
Not that one.
No, the one from the Department of Public Health.
I think so.
And I'm blanking on what the name of it is, but yes,
Yeah.
I know.
Yes.
Yes.
So like that data is out there, but it wasn't so useful in the best techniques we could use, because you could see like the top level like summary data, and one of the rules around it was don't try to re-identify people. But they're trying to go. So I had access to that data, and we could use it for really any purpose inside of our team that had the stipulation that we don't connect it to any outside other health data that we have. We just use it for employee benefits, like who qualifies for our wellness program. Send those emails too. But can there not be some sort of a group, like either within the university or within like some group of universities that can just have some amount of data like that on students to like answer questions that would improve, you know, the student's experience or improve other operational things around the university? Because it kind of seems like we give away our data all the time and don't really care because it stays inside of Google or it stays inside of wherever, or like Fitbit, and now Google, so a few hours ago, Google just bought Fitbit, so now Google knows when I go to sleep every night. So, and we just give that all away.
Yeah.
So why?
So, I'll just say one thing to that. I think that the key part of that is you just said 4 people. The
Yes.
volume of work it takes, and then having the institution value that, because four people cannot just voluntarily give their time to do this. It needs to be valued at an institutional level. So that's the institution has to decide that's the way we want to go on governance. That these are going to be the gatekeepers for the data sets, and they're going to run these analyses. But then on the flip side, the university would need to supply the resources and value the time it takes to do that.
I mean, and it's interesting, talking about what are some of the best practices to maximize the use. I mean, I'm hearing the example of why not spend the time upfront developing the data set, responsibly managing the access to that data set, and how the School of Data Science can help facilitate that, which, it's an investment in time no matter what. It's about how can you do that strategically while still kind of ensuring, obviously, the ethical use of the data. What other ideas do we have around kind of what are critical practices to maximize the use of student data in support of our mission, right? Because I think, again, the intention here is to further the student experience while being mindful, and it kind of results in needing to have structures. You've all talked about the IRB model, which is an interesting one, and you mentioned resources. And the IRB model is a pretty resource-intensive model, and it also values the participation of those of us who serve on it. Literally, I mean, we get a contribution for our time and service because it's not an easy proposition. And so when you think about data governance and kind of the investment that's required to do it right, is that a practice that you think would be effective? Is that something, you talk about, I hear you say we need resources both for the analysis, but also it seems that to me everything around the coordination and kind of the education around what we're hoping to accomplish is pretty resource intensive as well. And how do we value that?
And it doesn't always have to be extra resources, right? It
Right.
may mean that as I'm looking at my own unit, right, and realizing that as data governance becomes a more serious institutional commitment, I've got to make some different choices internally about which sorts of projects we're going to take on, and I need to reassign some
Right.
time and free up people to really be able to focus on this to do it well. It doesn't always have to be just give me more. But I do think we have to recognize that if we want to do this seriously, then we do have to make it people's jobs, and recognize that that's a legitimate job, even if it's not a new job. Does that make sense?
Can I ask you a question? This is just different from what you were just asking, but it's motivated by some comments made earlier. I mean, I guess that one of the major things that's happened in the last 15 years is that we can now we can now do a very good job of its free text. And we can pretty much exploit the information that's in the free text. That gives us the ability to avoid those ICD-9 code or ICD-10. Sorry, I'm behind finally. But ICD-10 code. Yeah, because I mean, when you go in there, you can find a lot. And the examples that you're reading in the literature now are not just universities, but actually states who are doing it for things like opioid addiction. Because when you go to an emergency room, there's no CPD-9 or CPD-10 code for that. But
predict, he comes to the hospital who overdoses, isn't breathing, and has what's known as an oxygen brain injury, didn't have enough oxygen to the brain, right? They're intubated, there's critical care time that's associated with it, the diagnostic codes are coma, right? Respiratory depression, but it may not have opioid on there, maybe even no.
Right.
This goes back to the Drug Abuse Warning Network that was discontinued in 2011, which are about ready to start again. I heard that this is where they used to go back to the emergency department records. This is without the language programming. Individuals would actually, at the poison centers, would go through those at some of the facilities. VCU used to do this. And they'd look through the charts to see if the reason for that visit was associated with opioids or another drug abuse. And they got really rich data from the Drug Abuse Warning Network. That was actually the network that showed in 2007 and 2008 that the opioid problem in this country was actually more from prescription drugs than illicit drugs. It really highlighted at that time. That was because of going into the records, and that point is very well taken. I'll throw one other thing out there, and this gets to be with data governance, then back to home. The Faculty Senate survey that was done, and I helped lead that when I was chair of the Faculty Senate. And it was an intriguing process that was supposed to be anonymous, which it was. The comments were really rich. We actually had the schools, we had each school go through a different school, the comments, to really take out things that might be identifying with the comments, so that those comments could then come out later with the school, so that we could have discussions on not just the question and answer, yes and no, but also the comments that were in there. We thought we did a great job of de-identifying. We did not. Actually, it was unbelievable. There are people in the school who go, oh, I know who that is. They talk exactly like that, use the same adjectives. But that was really stunning to me when we did that exercise. And we kept it within our executive group. But it shows some of the challenges of this too. So you're absolutely right. There's rich data in medical records where you could, and with some of the language, you know much better than I do, the language programming, where you could pick up some of this on why they're coming and go away from those ICD-10 codes now.
So that reminds me of something we haven't talked about yet, which is that we have new data sets forming, even as we're speaking, right? Because schools are, and I'm thinking back in the student record realm, schools are increasingly, back school is already using an online software platform for its faculty advising. So you've got now faculty advising notes. You've got learning management systems and all kinds of data in those learning management systems around student learning and student work. And it's just a matter of time before people start wanting access to that, right? And we're just not prepared for it. You know, we're not. We're implementing a new course evaluation tool that actually comes with a text analytics tool, and has algorithms, and it goes through and identifies certain themes to avoid having to share the raw data with people. You instead sort of get the themes and the frequency of the themes, and so yeah, text analytics I think is very much starting to emerge as both a rich source and a possible challenge.
Yeah, I was going to say, I'm always listening to the data system on data. I will caveat though, it goes back to do you have someone who knows what the tool is doing in terms of what data has come out? So one of the issues on the health side we find a lot of times is the text analytics can pick up certain keywords, but not necessarily the tone around its usage. So there's times when something will be included because a doctor will say something like, not this, which becomes a clear thing, but it's also, I'm not sure, maybe, and it's, well, what does that mean? But the text analytics can pick up, depending on how it's programmed, it can interpret it in different ways with different software. So knowing what's being done becomes really key to understand what the results are, even at an aggregate level.
Okay. What, any other thoughts or questions? I want to make sure I'm being mindful of the time.
So I have a question about some of you both have mentioned data access and controlling data access. And I come from this very different point of view, not privacy or anything, but security and ITAR compliance. So our data is not about people, it's about stuff that, stuff that could be a violation of ITAR if it was shared internationally. And our data
intro to statistics class, and now I know what I'm doing. I will use a paper I was reviewing last night where my husband reckoned I was joining the storm level with my rage because they said they were doing things that we proved 20 years ago gives you biased results, and they were basing their conclusions on these analyses. So I think there does need to be, as part of access, partly vetting what are the qualifications of the people who are part of the team who's accessing it. Everyone who wants access doesn't necessarily know what they're doing with data. I think that's also where, you know, the data science school comes in handy in that collaborative model. Someone knows what they're doing with. But there also is a level of trust. We can't protect from everything. There is a level of training and trust that we can train so far, and then we have to trust. So at my prior institution, I used to do a lot of training. The students used to joke at the end that they were scared to touch data. I thought I did my job. But I also joked we were the only department that did not have a breach that was caused by students, because we kind of did the training and scared the jeepers out of them on what the consequences would be, so that then we actually could trust them with certain access because we knew what they had been trained on, but others didn't. So I think for a good governance model, we kind of need to work out where is that level where we expect you to know, and then we're going to have to do some sort of trust, or else nothing will get done.
But Laura made a good point earlier, right? We train you, we trust you, and we verify, right? And all of that takes resources, right? Which have to come from somewhere, and we haven't figured out how. I don't think.
I still think also we can create tools that increase access and reduce the need for trust. I mean, some of the things we've talked about here would go a long, if we could implement them on the student side, would go a long way towards giving people what they need and addressing my concerns.
I think there's also value in letting people explore data. They don't need to be data scientists. I'm not talking about deep data science here. I'm talking about somebody in an office somewhere who give them a tool that allows them to play around with data a little bit, and then, you know, help them, or give them the opportunity to come back to somebody who is an expert and say, hey, this looked interesting. Am I looking at this right? But if you don't ever look in the data, you're not going to come up with insight, because we're not the subject matter experts.
No, like I said, that's where the model where we had the cloud with a limited amount of data was nice, because we could give a lot more people access to that where they could play, but because they couldn't download anything, it then became, okay, before you go and make conclusions on this, you actually need to go the next step, that you can play and get a lot of insights. And I mean, we know a lot of people use it as, you know, we can write a little section, preliminary data in the grant, because this looks interesting, but I don't have access to the raw data to go too far before I get that team involved who understands the content, the data, the subject matter, all of those together.
Her question also on security brought up another light for me, which was where people were actually protecting data, not for the sake of the data, but for the sake of the organization. And I guess I you know, hearing a little of this conversation, it makes me think of that issue, because you're spot on, Laura. We want to protect the students, absolutely. But let's not go, and we want to make sure that, you know, we're doing the right, people are doing the right analysis. Well, let's be careful that we don't overprotect, in the sense that we're protecting ourselves from ourselves, which I guess is another thing you have to think about in data governance.
If you look at large organizations, you're talking about, you know, do students know the value of their data? Are they completely informed? When I think of an entity that is completely informed about the value of their data, I think of a large, you know, a large company. And if you went to, I'm just using an example, if I went to Boeing and was like, hey, I really think I could do something great with your test logs from your test flight. It would be like, yeah. And I'd be like, I got $1 billion. And they're like, no, it's not worth $1 billion. I mean, so they very much know the value of their data, and they're not sharing any of it, even if it would
Be interesting.
and even if you could
question.
cure all the world's ills with it.
I think it goes back to Laura's earlier comment about we really need to work out where is our limits. What be useful for it, and then where will we not go because we know the value of that data either internally for us, and the value of it for our students, for ourselves, where are those limits, and so that we can do the same thing. You want this? Not with $1 million, not happening.
That's a great way to end it. By the way, I really do think that the partnerships and the possibilities that the School of Data Science are gonna help enable.
Any pressure, but
As we head into a meeting, as Mark and I head into a meeting on Tuesday to talk about data governance with the 2 executive vice presidents. It's a good ammunition and context for that conversation. So thank you to the 3 of you. I really appreciate it, and to all of you for coming.